right, so welcome to the Leading Movement Health series, and I'm your host, Phil Wagner, founder and CEO of Sparta Science. And here we host discussions with invited guests that have this vast experience on the intersection of both leadership, but also around health as it relates to movement. And, we define movement health as really the ability to move without pain or fear. And so a lot of times we have the data now from wearables and research and even the insights in some cases. So why aren't we actually making more progress? And a lot of times it's the leadership that is the key to allow organizations to be more successful. So today's episode is really about the importance of movement health screening in large organizations. So I'm really excited about this episode because joining us is David Shulkin. And David was the 9th Secretary of Veteran Affairs, and he was also the Chief Medical Officer at University of Pennsylvania. He's published research, several times named one of the most influential people in healthcare. And I bring all these up because leadership is probably the most stressed at scale. And we can't forget that, the VA is the largest U.S. healthcare system. There's thousands of facilities. There's over 300,000 employees. So when we talk about scale and stress on leadership, values, culture, you'd be hard pressed to find a more challenging environment than the VA. And so we're going to talk about how screening and movement health, how do you provide care to millions of people through this largest U.S. healthcare system? So I want to welcome David Shulkin and thank him for joining us.
I'm glad to be with you, Phil.
So David, we're going to start and go through just kind of 3 questions around movement health and discussions. And you have so much experience around these large organizations and even can think so abstractly around how movement plays such a big role. And I've learned so much in the discussions we've had and how it relates to different areas. And so, the first question is, how does movement health you see playing a role in areas that people might not think about a lot of times? I know we've had some discussions about the relationship to neurology and some of these other areas. So talk a little bit about how you see movement health having an impact.
Phil, I think one of the real lessons that I've learned from the Department of Veteran Affairs is that leadership, typically people think about how can I grow programs, how can I further develop areas and explore new grounds. I've really come to believe that in healthcare, one of the real responsibilities of leadership is to actually break down silos. And we've become so specialized and we've become so disintegrated in the way that we deliver care by simply looking at the way our system works and being able to break some of these silos down. I think leaders can do the most good and have the biggest impact. And so when we talk about getting people to be healthy and well and functional, you're really talking about the intersection of mind and body. And what does that mean? That means being able to understand the importance of movement, the importance of psychological health, the importance of the physical condition of the body, the thing that traditionally physicians have thought that's their area of responsibility, but also many of the social interactions, the economic interactions, the spiritual interactions. And the more that we can begin to integrate the way that we think about health and wellness as being a more comprehensive definition, I think the more good that we're going to do in addressing the illness issues that we see so prevalent in the population, whether it's weight loss, whether it's behavioral healthcare issues like depression, or frankly, issues that relate to very common things like pain management or physical limitations that people have. So I think that what I learned in coming to the Department of Veteran Affairs is that I actually broadened my definition of health to include those things. And what's so great about the VA is that when you're freed from many of the reimbursement challenges that our colleagues have to deal with every day in the private sector, when you're free of those reimbursement challenges and you get to focus on what's the right thing for a person for a patient, you come up with an answer that's much more of a whole health model that integrates psychological, physical, and movement health.
Hmm. Yeah, and when you talk about breaking silos, I reminded of a quote someone told me once, which is innovation is not about invention, it's about adoption. And so much about adoption is breaking down those silos so people can work together more as a team.
Yeah, and that's where I think leaders really do have that responsibility because you can come in and you can caretake an organization. You can incrementally improve it. You can improve your, bottom line results. You can improve outcomes, but it's really only the good leaders that really take a look at what they're doing and saying, are we doing the right things? Is there a better way of delivering the care? Is there a better way of impacting people's lives? And sometimes that means having to break down systems that simply are barriers and that aren't working for people.
Yeah, and I think your example of pain is a great point because it's so multifaceted and that it's not really going to be addressed in an organization that has silos because there's so many different roots of that pain.
Yeah, and again, the Department of Veteran Affairs has done a really interesting model of care with pain, and that is they've developed interdisciplinary teams of clinicians, um, pain physicians, pain psychologists, physical therapists, peer coaches that work together in an integrated way with the patient to help them find their own way of leading their personal healthcare journey.
Mm.
And when you give patients the tools included in that information on how they can move better, how they can address their psychological and their physical issues, I think the results are far more impactful than our traditional models of pain management.
Mm. Yeah, well said. Yeah, I think so. That's a great segue of, what are, these interconnected, interdisciplinary teams, is something that VA has really been on the forefront of. What are some other kind of challenges, even specific to movement health, as you've seen, the VA or healthcare overcome? I know we chatted some about primary care and how VA has kind of been in the home, that forefront of bringing care into the home.
Yeah, VA has a responsibility to take care of veterans no matter where they live.
Mm.
And that means sometimes there aren't facilities that are anywhere near where those veterans are. And that's unique. Most health systems have buildings and they define their catchment areas where people are willing to travel from their homes to those buildings.
Yep.
But VA doesn't have that ability. It needs to figure out how to deliver that care. It also has the responsibility for care from the time they start caring for somebody when they leave military service until death.
Mm.
And so there's a long-term care benefit. So when you think about the alternative to a home, you often towards the later stage of life start thinking about institutional settings like nursing homes, which are not only very expensive but often not the place where people want to be. So care in the home becomes very important, and so VA has developed models where they actually bring those services that are needed into the home, entire teams of clinicians with primary care providers and other types of clinicians, and the use of technology to be able to bring that expertise into the home, but also collect information from the home back to the clinicians. And so I do think that once again, when that economic issue of how you get paid is removed, and that's not the issue in the VA, the issue is Congress gives all of our money to the VA to be able to care for veterans. So it gives the freedom to design a system that frankly makes a lot of sense. And that means you should deliver that care in the least restrictive environment. And oftentimes that's the home.
Yeah, you keep using this word, which I love, responsibility with leadership. And, and in that case, the VA's responsibility for the veteran, throughout their life or the remainder of their life, which, to your point, creates much more of a incentive, right, to go to them outside those four walls.
That's right.
Mm. So, with all these, advancements that the VA has been leading, and I believe, correct me if I'm wrong, VA is also one of the originators of the electronic health record concept, right?
Well, yeah. I mean, the electronic health record of VA was actually developed by clinicians underground, where the VA administrators had forbid them to do it. And of course, that only encouraged them more. But ultimately, when it came, into full view and the VA did adopt it, it was probably the first system at scale to adopt an EHR. So that was well over 35 years ago.
Fantastic. Yeah. Yeah. It's also good to have that kind of leadership that is flexible, right? Well, they initially resist it, eventually they may, be flexible enough to change that outlook.
Well, when the clinicians get a real determination that this is the right thing for the people they care for, the administrators better get out of the way.
Yes. So with all these advancements, what do you see kind of as the future for healthcare, which may or may not involve movement health? What do you see as the future as we have all this technology and infrastructures that are continuing to advance?
Well, Phil, as you know, we're at a time in healthcare where the adoption of change has never been quicker. And, healthcare has been stubbornly slow to adopt change, but those days, I think, are increasingly bygone days where there's really no going back. And so I think that there are a number of factors at play. One is that the current system that we have, which is fairly inefficient, where access to care is still a challenge depending upon where you live, where outcomes are dependent more upon your zip code than they are upon almost anything else, and where the patient themselves is at the end of the decision making, where it still is a healthcare provider driven decision making process. All of that's rapidly changing with technology. And the technology that I think that most people think are accelerating this change is the democratization of data and of understanding what science is really saying. And if you can take that away from just being owned by healthcare professionals, but now allow the patient to be an equal partner in their healthcare decision making, you're going to see very rapid change like you've seen in other industries that are much more consumer driven. And now with artificial intelligence and what everyone's talking about, of course, generative AI, chat GPT, and other platforms that are being developed, if patients can simply ask their phone questions and get answers and get access to their own data and understand how they can use that data to improve their health, I think that's the future of healthcare. And if we don't begin to understand where healthcare is going and embrace it, we will be like those administrators in VA that were telling their doctors, don't develop this electronic health record. That's not where we're going. And it's a losing battle. And so, the enlightened leaders understand where healthcare is going and want to be not only on the forefront, but want to help facilitate those types of uses of technology, because our current system certainly has some strengths, but it certainly has lots of flaws.
Yeah, and I think that ownership and understanding by the patient of their own data is only going to enhance any sort of habit changes, right? That, really are only going to improve their health and longevity.
I think that's right. And I think when the patient has access to their data, when the patient understands that the mind and body are connected, when the patient understands that when they want access to care, they want it when they need it, not when it's convenient for the healthcare provider. This is how you accelerate the change in healthcare.
Hmm. Well, that's great. I appreciate, your time. You've got always a pretty busy schedule, and I usually don't even catch you when you're home. So, I wanted to kind of wrap up, at least for me, three leadership tactics I took away is one, it's the leader's responsibility to break down silos in the organization. That was a big takeaway for me. I think the second was, in healthcare and really in a lot of industries, we can't define, that goal by the buildings where we live and operate. It's got to be outside those four walls. And then the last was the point we just talked about, it, the need to really democratize the data and, really kind of embrace it and try to empower it as opposed to, resist it, and create another EHR scenario where we're trying to condemn something that in a way is almost inevitable.
I think you're right, and I'm pleased that you were able to summarize it so succinctly. I'm not sure I would have been able to have done that, but I do think that those are ingredients for both leadership and where healthcare needs to go, and I do believe that these are very realistic things to happen now. I've referred to a couple times in our discussion, Phil, that often knowing what the right thing to do is in healthcare is necessary, but not sufficient. And so you also need an alignment with the business model, with the way that healthcare is paid. And so what we need a consensus among payers and providers and patients about the right direction in healthcare. And I do think breaking down the silos, making care more accessible, making data more available to patients is the way that those three different groups can begin to align with all similar interests that will improve our healthcare system.
Fantastic. Well, David, thank you. Thank you for your time and insights. Always fantastic.
Glad to be with you, Phil.